I'm wondering what some of the symptoms of a stroke might be, what to look for.
You know, Raina, that's a very, very good question, and the symptoms of stroke can be quite variable, simply because the stroke can occur in different parts of the brain, and depending upon the part of the brain affected, you may get different symptoms. It's common for people who have a stroke to have unexplained numbness or weakness in a certain part of their body, maybe in their face or in their arm or leg or both. And it's more commonly one side and not both sides. The other thing that can happen is people can have episodes or sudden onset of confusion, trouble speaking. They know what they want to say, but their vocal cords won't work correctly and they can't speak. Or they may be not able to understand. So if you're with someone and suddenly they become confused, they may be having a stroke. They may have double vision or difficulty seeing. They may suddenly have problems with their balance or their coordination. So the symptoms can vary. A lot of people assume that individuals who are having a stroke will have a headache, and indeed some people have a severe headache, but a lot of people will have no headache at all. So if you have any of these symptoms, you need to get checked out and get checked out immediately.
Or like my grandmother would say, I'm not feeling right.
That may be the only symptom you have. As we talked earlier, they're more common in older people. But if people have unexplained symptoms that they don't feel right, they for a few seconds were unable to speak, or they had transient double vision, or weren't able to write, or weren't able to speak, even if it's just for a few seconds, they may be having a stroke or symptoms of what we call a TIA, or transient ischemic attack, which is frequently a precursor to stroke, and they need to go into an emergency room, call 911, and go in and get checked out, because there are life-saving drugs available that may be able to prevent them from having a full-blown stroke.
So we're looking for a variety of symptoms. You may only have one of them.
You may only have one of them.
Okay.
And of course, if you are unfortunate and the stroke involves a fairly large blood vessel in the brain, you may have all of those symptoms. But the key is to, if you have just a few or all of them, time is really a factor here, because we can dissolve these clots in many instances now, and reverse the effects of the stroke so there's not permanent damage to the brain. So if you're having any of those symptoms, go get checked out as quickly as possible.
Excellent. Thank you.
Thank you, Raina.